welcome back. Now, among women between the ages of 15 and 44 in Kenya, cervical cancer ranks as the most common cancer likely to affect this age bracket. This is according to the Human Papillomavirus Center Research 2018. Moreover, the human papillomavirus, also HPV, is the most common cause of the cancer, which in a developing country as Kenya is unfortunately caught at very advanced stages. We make our way to Kariobangi in Nairobi County to meet Millicent Kagonga and her friend Philomena Ochola. Although hard to tell by the eye, by their bubbly and welcoming nature, these two have undergone treatment and are managing cancer, that one of the cervix. Millicent herself noticed vaginal bleeding, which she did not understand. Coupled with lack of proper knowledge, she faced lack of medical knowledge and misdiagnosis, not to mention lack of financial capability to get treatment.
Na saratani unahitaji mtu mwenye atakusikiliza. Kwa natoa discharge, nilikuwa naona damu, na hiyo ndio ilifanya ndoa yangu ikasambaratika. Nikajipea stigma for 6 years kwa sababu sikuwa nataka kuiongelea juu yake. Sasa nilikuwa najiwekea t-shirt juu nikitumia pad, na need pad kama 10 hivi kwa siku. Na sana ukiangalia kuna test ambayo inaitwa biopsy. Biopsy inahitaji pesa mingi sana, na ninaomba NHIF ianze kukava biopsy. Sababu biopsy ndio ilinifanya nikachelewa kwa matibabu. Na wakati nilifanikiwa kufanya biopsy, nikaanza safari ya kuanza matibabu 2017. Nimefanya niliandikiwa kimo 6, lakini nilifanya 3 kwa sababu sikuwa na pesa ya kulipa blood counts. Alafu pia nikafanya radiotherapy 25, hizo NHIF ilisimamia, na nikafanya brachytherapy 3.
On almost similar of a streak, Philomena as well faced a broken marriage after the symptoms of cervical cancer manifested itself. The community around her couldn't fathom her change of health, most specifically the bad smell.
When I started having back pain and having pain on the lower abdomen, and I went to Mama Lucy Hospital, and they told me to see a gynecologist who did a CT scan and told me that I had fibroids. So I opted to go somewhere and I did the surgery. When the surgery was done, the gyno himself noticed that there was some kind of tumors that were there and asked us to go and get an histology report. So I had to come back and go and get a histology report done, which showed that there were no cancer cells.
All this preceded treatment at various hospitals in the country, the likely fallback being the largest referral hospital, Kenyatta National Hospital, where we met Dr. Njokinje Raine, an oncologist who breaks down cervical cancer.
Human papillomavirus, or HPV, is basically, I would say, a sexually transmitted virus. Usually the body clears it away without any problem. The problem is repeated and continuous infection with HPV, and that's what causes changes in your DNA, because cancer is basically a multiplication of cells that something has triggered them to divide. So human papillomavirus is interesting because you have different strains. The ones that we usually look at are called the highly virulent ones, is HPV strain 16 and 18. And that, once it gets integrated into the cell, it goes into the DNA and basically takes off the brake that causes the cells to continue to divide. Apart from cervical cancer, HPV has also been associated with cancers of the oropharynx, which is basically the back of the throat, penile cancers, anal cancers.
Signs and symptoms of cervical cancer according to World Health Organization: irregular and intermenstrual bleeding between periods, abnormal vaginal bleeding after sexual intercourse, back, leg or pelvic pain, fatigue, weight loss, loss of appetite, vaginal discomfort or odorous discharge, a single swollen leg. Prevention is better than cure, they say. Millicent and Philomena had to endure weeks of treatment, which they described as brutal, and eventually contributed to the closing down of the vagina, in whose opening demands a dilator not available in Kenya.
Ileta ni kitu yenye mwanamke unafaa kutumia kuingiza njia zako za uzazi za siri kufungua wakati ushamaliza radiotherapy, hiyo sehemu inashikana.
You find people are not able to hold urine as much as possible after getting the radiotherapy, and behind that is the rectum where the stool comes out, and some people will get problems with either controlling their stool, they might have bleeding in the stool, or increased frequency of passing stool. The side effects are you get a reduction in your white cell count, which then predisposes you to getting infections. Your platelets can go low, which then increases the likelihood of you having bleeding. You get nausea and vomiting, which you're able to control with good medication. But then you also get other changes like your nails become black, your skin can become...
The Kenya government, through the Ministry of Health, is expected to roll out a HPV vaccine in what can be described as a preventive measure. However, the Kenya Association of Catholic Doctors has stated that the girls the age bracket of 10 to 14 are far too young to be at risk of having HPV, which is sexually transmitted. But Dr. Njirene has a different opinion about it.
If you're to think about a virus that is transmitted sexually, it would be logical that you then vaccinate both girls and boys. If you know that a certain type of cancer is 90% of it is caused by a certain vaccine, then it would mean that if you have a vaccination that works to control 90% of the cancer, it would be in the best interest to look at what data do we have available in terms of safety. That's number one. Efficacy, how effective is this vaccine in terms of controlling the cancer?
In 2013, Rwanda rolled out the HPV vaccine in the country, being the first in Africa. Malawi and Tanzania are also following step. Cervical cancer is described as manageable, but in a low-income region like Kariobangi, the finances used to treat it is as scarce as the knowledge about it. Now the government intends to roll out a HPV vaccine. Does it stand any chance against cervical cancer? Christine Kamau, KUTV.